Okay, so for throat pain, thyroid issues, laryngitis, that kind of thing, we're going to do a feel up in here, and you can feel here knots in there. You'll be able to feel little bumps in there. That's where you're going to work for laryngitis or sore throat, especially. We're gonna come right down. We're actually gonna drain it. So we're gonna come right down the side of that, and you're gonna press as hard as you think you can. You know, you're not going to press right into it like that because you do have a throat there, right? Down into there. Okay, we're gonna do that on both sides. And that should free up any of the fluid that's in there. But we're going to keep going. We're going to go one more back. And another one. It's going to get rid of all this fluid pressure that we have in the neck and throat. Okay, and then after you get rid of all the fluid in there, then you should be able to go back and you should be able to feel the swollen lymph nodes. You should be able to feel any kind of inflammation or swelling or anything in here. And if he has a sore throat, you know, he's probably going to have like lymph nodes swollen like in here. So we're going to put this directly on that lymph node, and we're going to kind of push. Some people call them glands, swelling glands. You're just going to find those, put it on there, and push. Make sure you use the jump foot because it's probably pretty sore. If it's not that sore, you can use, if you use the barefoot fork, it would be to your advantage. But we're going to use the jump foot because we're pushing that fluid out of there at the same time. This will also get rid of colds and bronchitis and things like that that won't go away very easily, that they're holding all this bacteria and stuff in the neck. So drain the neck, and then for thyroid issues, we're going to use the barefoot fork. And we're going to put it right on the thyroid. The thyroid is a butterfly shaped. Put your head back, please. There you go. Right above the Adam's apple here, you can see the Adam's apple. Right above the Adam's apple, the thyroid's kind of shaped like this. So we're going to do right above the Adam's apple. And you're going to feel, so a lot of times when it depends on what's going on with the thyroid. If they have an overactive or underactive, we're just going to, you're not going to feel anything. As far as like inflammation or bumps or knots or hard or stiff areas, you're probably not. So we're just going to work all the way around this thyroid. We're basically just going to put a lot of vibration in it so that the inflammation goes away. And you can feel on this side, it should feel just as strong on this side as the other side where you have the tuning fork. And if it doesn't, then you need to do it a few more times there, and you'll feel it getting stronger. Yep, now I can feel it's getting stronger on this side. And you can do the same thing on the other side. Put your hand on this side. Put it right up against it like that. I can't feel it at all on this side, so I have to keep doing it. I can start to feel it now. Keep going. And we're going to do that on both sides, and we're going to do it right in the middle too. So you put your hand on the back of the neck, and you should be able to feel this just as strong in the back of the neck as you do here on the tuning fork itself. Right above that Adam's apple. As many times as you need to be able to feel that vibration. Okay, and then for your parasympathetic thyroid, we would work on the back in the same place, and we would do the same exact thing on the back of the neck. It would just be a repeat on the back side. Of course, we wouldn't have that Adam's apple, but you can tell back there where it's at and where it goes. It's in the same shape and everything. It's shaped like a little butterfly. But so that's sore throat, laryngitis, tonsillitis, that kind of thing. We're even going to do our pendulum swing like this and bounce it off our hand. So let's do that. And then we're going to go up in here for tonsillitis. Your tonsils are going to be way up in here, like right here, and even back further. So we're going to go right under the jawline, barefoot, because we want to get that inflammation down. You should be able to feel the vibration on this side all the way back. So we're going to do it again. And go towards the back of the throat. Again, you should be able to feel the vibration on this side. Again, back. Now we're back to where the tonsils are. You may even feel a lot of inflammation more on one side than the other, like right up in here. That's because that's exactly where we want the vibration to be. So we're actually just going to stick it up in there. And really pay attention how I'm holding the fork. Gives you quite a big advantage if you can maneuver it better. And that's tonsillitis. You're just going to go right up in there, all the way back to about right there. You'll be able to feel those tonsils up in there, how they're swollen and knotted up. And you can even, once you get those loosened up in there, if you can still feel a lot of inflammation, a lot of fluid build up in there, you can even go right along the area we just worked. So right towards the Adam's apple. So from here, we're going to go right towards the Adam's apple. Like that. Okay?